These are some of the best exercises and things to consider doing after you have a Dupuytren's release type of surgery. My name is Huang. I'm an occupational therapist and certified hand therapist. And usually with Dupuytren's disease, a hand therapist will see someone who, like you, who've had the surgery after you have the surgery. And it's really important to go in a timely fashion, right? So after the surgery, you can have the surgery. Let me grab my pen. You might have the surgery here in your palm. Sometimes people will have the surgeries here in what we call your middle knuckle, your PIP joint, because the disease process is basically it's a cord-like disease process that pulls your knuckle down. This is your big knuckle. This is your middle knuckle, and this is your little knuckle, or your MP, your PIP, and your DIP, right? So the cords will pull this big knuckle down like this. And so this finger is coming down. Sometimes the cords will extend into your PIP and start to pull your PIP down. So sometimes people have just that one big knuckle. Sometimes people have just the PIP that's getting pulled down. And the worst case is when it's pulling down at the MP and at the PIP. And so you see how that can get in the way of your hand. So majority of the time people are going to have surgery to release the cords so that you can start to move better and have less interference with your hand so your finger's not getting in the way. I'm showing you with the ring finger just because it most commonly happens in the ring finger, but it could happen in any part of your hand. Just the ring finger is the most common one. So after a Dupuytren's release, one of the most important things to do is going to your hand therapist. Go find an occupational therapist or a certified hand therapist in your local area because you're gonna need what is called a custom fitted splint or orthosis, and you want to make sure that it's done so it's placing your knuckles in a straight position as possible. You don't have to wear those all the time, but you want to wear it especially at night to kind of stretch and move those fingers and get them what we call extended, get them straight. Because the whole point of the surgery was because it was bent, right? You want to work in the opposite direction, which is now to get it straight. So number one, you definitely want to get a splint. You might be able to order them online, but a lot of times they're going to cover more than what you need. So when it comes to splinting, if you cover way too many things, you can actually um, develop other problems like stiffness and not being able to move. So you want to definitely use it very specifically for the issue that you have, and that's why it's so important to find a therapist right after your surgery. The second thing is you're going to want to make sure, yes, let's celebrate. Second thing you want to make sure you're doing is talking with your therapist about how to make sure your wounds are clean and dry and that they're healing really well because you have to exercise that hand. The great thing about Dupuytren's disease is nothing is broken, nothing is torn. You just have these extra cords that wrapped around, sometimes they wrap around your tendons, sometimes they wrap around some of the nerves, but basically it pulls your joints down. So once they're released, you have the best possible chance of getting the best possible recovery when you get started really early. So as the wounds heal, you can start to move more, right? You're allowed to move right away, like pretty much right after the surgery. Day 2, day 3, you can start moving already. So here are some of the best exercises that I recommend. So since Dupuytren's pulls this big knuckle down, what you want to do is pull that knuckle back, right? This is the exercise. I know you were like, Huang, show me something complicated. It's not that complex. What you want to do is be able to pull this knuckle back. That's all. That's the stretch that I want you to do. Now, just because you had surgery to one finger doesn't mean you shouldn't stretch the adjacent fingers. Your neighbors next door need a little help too because the muscles that are in your hand are really tiny and they affect one another. So you can pull this knuckle back, hold it for 10 seconds, pull this knuckle back, hold it for 10 seconds. And you do the adjacent fingers, meaning the ones next door, right? And you're just going to hold those for 10 seconds. Another way to do it is a pen test, right? Or a pen exercise. You just hook your finger like that and it does it for you. So you can just hang out, talk to a friend, do whatever, and have that there. And then you can go to the next finger, right? So that is stretch or exercise number one, and it's really key for these big knuckles. The second thing you can do is you can use that same pen in that same position and oops, yeah, in this position, right? And you can open just like that. And then relax and open, and just like that. The reason why this is important is the disease has been cut, has been removed so that the tendons and the joints can move better. So normally as a therapist, the Dupuytren's disease process, those cords, you can't really do too much about them once they set in. But once the doctor does the surgery to release it, now this is your best opportunity to work your tendons, to work the joint, to make it feel really flexible, right? That way you don't have that constant tightness. The tightness that you feel in your hands due to the Dupuytren's is the joints, the muscles, and the tendons having compensated around how that fascial nodule has grown. So this is a great time to stretch it out. So you're just going to put that pen there and you're going to work on opening. The disease pulls you down. So making a fist is not going to be a problem. Opening is going to be your biggest mission after surgery. So outside of stretching it, then you're going to actively move it. And again, don't ignore your neighbors. Don't ignore them. You want to make sure that you're working your adjacent fingers. But guess what? When you work that middle finger, the finger next to it, it's making the finger where you had the surgery work as well. So it's really key to working all of that. Work the main finger and then work the ones next to it so that you can get the best possible chance after. So those are my major two exercises for your big knuckle. Now, if your middle knuckle, right, your PIP joint is contracted, that same exercise is going to be really helpful. Because when you put this to stretch the adjacent fingers, this finger that you have the issue with can work to get straight as well. You see, I'm gonna curl down a little bit and then I'm gonna push it open, push everything open. This pen is going to isolate. This pen is going to isolate what this little knuckle, this middle knuckle can do, right? So it looks the same, but what you want to understand is the intention behind each of the exercises so that you move your joints very purposefully, so that you get the best possible results, okay? So that's an exercise for this one. Now, if you want to pull down, right, which is important too, because the scar is here in your palm, and we want that tendon to be able to glide through the scar area. When the tendons glide through that scarring, it's going to soften that scar from like adhering, getting hard, and sticking down. My best exercise is called a hook fist. All right, so a key thing is you want to hold your big knuckles straight and you want to curl your little knuckles down. So I tend to put my fingers right where your big knuckles are, and that way I also help control my wrist so that my wrist isn't pulling down. So fingers like this, curl all the way down, and this is called a hook fist. Another way to do it is I like to clasp. That way I separate the little muscles in between and I do what's called a hook fist. You can do 10 of these. Now, it is normal after surgery to get really stiff. But these exercises can help you against that stiffness. It could help move that scar. And there's a lot of other things that you can do after a Dupuytren's release to get the best possible result to get the most amount of motion out of your hand so that you don't feel so stiff. Key thing about Dupuytren's disease, it tends not to be painful. But what happens is it pulls and stiffens the joints, and it happens slowly over time, so you kind of don't notice it until one day you notice it. So if you're going to do the surgery, definitely go find yourself a great occupational therapist, a certified hand therapist that you trust, that can help answer your specific questions, help guide you towards the specific exercises that you need. Every Dupuytren's disease hand I've ever worked with has shown up differently. Some people have it more severe than others. And so some people have it very little. And so then you don't need as much. But if you're going to have the surgery, make sure you find a trusted therapist so you don't use the splint too long. You actually move in the right way, in the right timely manner, so you can avoid things like having a completely stiff hand. Someone messaged me because they saw some videos and they're like, well, what do I do? I said, well, I don't know exactly because I don't know your history and I don't know everything. But if you develop a stiff hand, it's totally possible to um, unstiffen it and get it moving well. It just depends on how stiff you are and how painful you are. But that's why working with a trusted occupational therapist or certified hand therapist can get you moving that much faster. But is it possible? It's totally possible to get rid of a stiff hand. It's just how hard are you willing to work on it to get rid of that stiffness? If you're watching this before your release, make sure you find that trusted therapist before so that you can schedule your time to get that splint. Make sure you know when to use it, when to get rid of it. Sometimes people don't get rid of that splint soon enough, and this is what causes the stiffness or the stiff hands. So I hope this video helps you, whether you've had the surgical release already or you're planning to have the surgical release. Those are some of my top exercises that I teach my patients, and there's so much more depending on what's going on with your hand. So hope you find a trusted occupational therapist or certified hand therapist who can help you. Again, my name is Huang. If you like videos like this, you have further questions, leave them below for me so I can continue to make more videos like this to help you understand what's going on and what you can do about it. I can't give specific medical advice, personalized medical advice, but what I can do is take your questions and turn them into another video. So if you like videos like this, hit the subscribe button and I'll see you on the next video. Thanks for watching.